Hi, I'm Dr. Ray Iannelli with Legacy Dental Group, and I'm here to talk to you about how we provide crowns, veneers, and onlays to our patients in one visit instead of the traditional way, which is two. A lot of our patients really struggle with getting dental work done. Some of that has to do with getting numb multiple times, having temporary restorations, or just the general anxiety of being in the dental chair. CEREC allows us to streamline that process and provide that final restoration in one visit. The traditional crown prep appointment involves getting the area numb, prepping the area, taking an impression with the goopy material patients are used to, as well as wearing a temporary for multiple weeks. CEREC allows us to streamline that process, avoid the impression material, avoid multiple times being numbed, and get the final restoration delivered the same day. Here at Legacy Dental, we value patient experience, comfort, and excellent clinical dentistry. CEREC is one of our technologies that allows us to provide that consistently. The latest statistics showed that less than 30% of offices are using CEREC technology on a day-to-day basis. But here at Legacy Dental, we value that, and it's a part of our daily routine in providing excellent care to patients. When you're a patient within our office and you're coming in to have a crown appointment done, what you can expect to experience is an evaluation of the area we're going to be working in. We would anesthetize the area like we would doing any dental procedure. Then we use our CEREC camera to scan the area, getting an image of how the tooth looks before we prepare it. We prepare the tooth, and then once the tooth is prepared, take an additional scan, which allows us to fabricate that final restoration. The patient sits and waits comfortably in the chair, sometimes watching TV, as the restoration's being made. While the patient is still numb, we fit the restoration and cement it, and the patient leaves ready to use it immediately. No more having goopy impression material in your mouth, having to come back, have a temporary removed, and get anesthetized again. This is all completed in the same day. Some of the major advantages of using the CEREC technology is avoiding impression materials, avoiding temporary crowns, which patients typically wear uncomfortably for a number of weeks, the ability for us to prep very selectively and to conserve more tooth structure, using still the same materials a traditional lab would use without sacrificing any of the quality or durability. After you've had a CEREC crown made, that information is saved within our computer system, so there's a digital record of that restoration, allowing, if there's any future changes in that tooth, us to recreate that restoration before you're in the office and have it ready to be re-cemented in an emergency need. CEREC technology allows us to dramatically improve the patient-dentist experience by providing solid, long-standing restorations in a quick and efficient process. We've summarized the general use for our CEREC technology, but we understand every patient has individual needs. And if at any point you have any questions specifically about your case, please feel free to reach out to any of our locations.